Hi there, my name is Terry Lynch. I'm an Irish medical doctor, psychotherapist and author of books on mental health. Currently I've written 2 books. My first book is called Beyond Prozac and more recently Selfhood. And this is one of a series of videos that I'm going to be making about mental health, and in particular about truth in mental health, truth in the psychiatric approach to mental health, and in presenting ideas as to how we could understand mental health in a deeper, richer way. The purpose of this video is education, really, education about serotonin. And I've picked serotonin because serotonin has found its way into everyday conversation. People mention serotonin and serotonin levels now in ordinary everyday conversation, as if it has been proven that a low serotonin is responsible for depression. And I believe that this is the result of quite a successful information, or should I say misinformation, campaign to inform the public, or perhaps misinform the public, in regard to depression, and to present a simplistic idea of depression, that it's caused by low serotonin levels. And it's worth looking at this statement and seeing how true it is, and that's the purpose of this video. And in this video I'm going to compare depression to diabetes. For the past 20 years or so, many doctors in their discussion about depression have compared depression to diabetes, including statements that both of these conditions are caused by chemical imbalances. So a comparison between the two is therefore very appropriate. Now, I'm not suggesting that antidepressants do not help some people, but the public are entitled to accurate information. In my experience, working with people diagnosed with depression for over 20 years now, antidepressants appear to be fundamentally mood or feeling altering. Many people, for example, taking antidepressants feel numbed while taking them, and for some this may be a welcome relief from intense distress, and this makes sense. In some people, antidepressants have a stimulating and sometimes an agitating effect, and there is evidence now to link antidepressants with suicide, to the degree that warnings in relation to this are now contained in the packaging of these substances. Stopping antidepressants can be associated with considerable problems, and this video should not be taken as recommending or encouraging individuals to come off psychiatric medication. The purpose of this video is educational, to provide the public, to provide you with accurate information regarding antidepressant drugs. And it seems to me that the public are entitled to accurate information. So, depression and diabetes, and this issue of chemical imbalances, comparing the two. First question, the obvious question is, well, what's the chemical abnormality? In diabetes, there is no doubt. The chemical abnormality is that blood sugar is raised secondary to a deficiency of insulin. That's it in a nutshell with diabetes. Very simple, very clear. It's not at all like that with depression. Doctors talk about low serotonin as a possibility, but they also talk about other chemicals, such as low noradrenaline or melatonin problems more recently. And there's an adage in medicine that if doctors are presenting 3 or 4 ideas about something, it generally means they really don't know which is correct. Whereas with diabetes, the situation is very clear because we know. Next issue then is the diagnostic test. In diabetes, the diagnostic test is simple. It's a blood sugar level. And this test is always done when checking somebody for diabetes. It's always done. The diagnosis of diabetes is never made without having done a blood test or a series of blood tests for blood sugar. And the blood tests for diabetes are 100% reliable. Compare that to depression, where there is no test because there's no test available because it doesn't exist. Therefore, the diagnosis of depression is always made without chemical tests. And the tests have no reliability because there are no tests. And if you're looking at diabetes again, no doctor would ever diagnose diabetes without the chemical tests. And any doctor who did that would very likely find themselves accused of malpractice, Whereas precisely the opposite is the case with depression. Depression is always diagnosed without chemical tests. Next question in terms of a chemical imbalance is, well, what are the normal levels of the chemical and what are the abnormal levels? In diabetes, as in other chemical abnormalities such as thyroid problems, the normal expected range of the chemical is known. Final med students know what the blood sugar should be, and we can only know the abnormal level of a chemical if we know the normal level. I mean, that's common sense. Yet in depression, ask any doctor, what should my serotonin level be, doctor? And they can't answer that question because we don't know. And if we don't know what the normal level of serotonin should be, how on earth can we speculate on abnormal levels? It's worth saying that the only thing we can be relatively sure of in terms of antidepressants and serotonin is that they interfere with the uptake of serotonin in the synapses between brain cells, in other words, the spaces between brain cells. We do know that they have that effect. What we don't know is whether the levels were normal or abnormal in the first place, or whether interfering with serotonin levels in these synapses is a good thing or a bad thing. We don't know. Obviously, if we're talking about chemical abnormalities, we should understand the function of the organ we're talking about. And in diabetes, for example, the organ we're talking about is the pancreas. And doctors understand the function of the pancreas very well. And the microscopic findings in diabetes of the pancreas, for example, they're always the same. Little particles called the islets of Langerhans, they always have the same changes in diabetes. Nothing like that exists for depression. There is no part of the brain that we can say becomes changed in a reliable, predictable way in depression. Then the treatment. The treatment for diabetes is all about correcting the chemical imbalance. With insulin, for example, you're replacing like with like. Insulin is given because insulin is what is deficient. And the other drugs that are used in diabetes also have that effect of reducing blood sugar. So it's a very direct treatment for a chemical imbalance. It's not like that at all with depression. As I said, we don't know what antidepressants do to serotonin levels because they're never checked. And as a result of this, insulin, for example, it's a very precise treatment and it's very refined down to the precision of a single unit dose calculation. Whereas people put on antidepressants, they're generally all started on the same dosage. And there may be a few increased dosages one can use, but it's generally quite limited because one is not replacing like with like. How specific is the treatment for these conditions? The treatments used in diabetes are very specific. They're not used for other conditions. And that's again is because you're treating a chemical imbalance specific to diabetes. That's not the case with depression. And antidepressants, for example, are now widely used for anxiety, for panic, for phobia, shyness, social anxiety, obsessive compulsive disorder and anorexia, for example. Let's look at the monitoring as well, the monitoring in the early stages and how that relates to a chemical imbalance. When somebody is admitted to hospital with the crisis caused by diabetes, whether they're diagnosed previously or not, and they're found to have diabetes, then they have very intensive monitoring of their blood sugar levels. They will often have many tests every day, blood sugar levels, and often several tests an hour would not be unusual. And again, that can't happen with depression because the tests don't exist. As you would expect in a chemical imbalance, the response to treatment in diabetes is swift. The effect of insulin is measurable within minutes, certainly hours, that you can see the blood sugar coming down in direct response to insulin treatment. Whereas with antidepressants, they're said to take 2 to 3 weeks a person's said to take 2 to 3 weeks to respond to treatment. That is not what you would expect when treating a chemical deficiency with replacement therapy. You'd expect the treatment to be a lot quicker. If you look at the issue of ongoing monitoring, again in diabetes, the whole monitoring revolves around the blood tests, which are done on a regular basis. Indeed, most people nowadays with diabetes have their own little machine to check their blood sugar, and that's how they decide how much insulin they get. It's all about the blood tests. It's never about the blood test of depression, as I said, because the tests don't exist. What happens if you stop the treatment in these two conditions? If a person's on insulin for diabetes and they suddenly stop their insulin, they're going to be in big trouble very, very quickly. They will go into diabetic coma quite quickly and they will be dead within a few days if they don't receive the replacement therapy. Why? Because the chemical imbalance goes out of control without the replacement therapy. That is not at all what happens when somebody stops antidepressants. Yes, the person can go through withdrawal, and yes, the person's emotional distress can deteriorate, but it's not a chemical imbalance situation deteriorating. And again, we can't test it anyway. What about the effectiveness of treatment? The effectiveness of diabetic medication is 100% basically, because again, you're replacing like with like. So you expect it to be pretty much 100%. The effectiveness of antidepressants varies depending on who you're reading, from between 50 to 70%. You wouldn't expect that with a chemical balance, you'd expect 100%. What about response to placebo? Well, I think it's fair to say that in diabetes, no doctor would treat diabetes with placebo, and there's no response to placebo. So 0% improvement with diabetes because it's a chemical abnormality. However, in depression, placebos have been found to be 40 to 50% effective. Now, how can that be if depression is caused by a chemical imbalance? What about the response to counselling? No doctor would ever suggest that counselling would be a sufficient treatment for diabetes. Yes, there's counselling involved in how to learning about diabetes, but not as a treatment. So the response to counselling in diabetes is 0. Whereas in depression, it's a 40 to 60% success rate. And again, how on earth could a chemical imbalance respond purely to counselling? It doesn't add up, it doesn't make sense. Again, finally, duration of treatment. Diabetes treatment is for life, always. Somebody who goes on insulin will never come off it for the rest of their life. And the treatment will be monitored, will be decided on through the monitoring of blood sugar levels. Whereas with depression, the standard treatment is 6 to 9 months. And yes, some people end up on antidepressants longer than that. But it's not standard to be on it for life. And if a person has a chemical imbalance, surely they need medication for life. What about life off treatment? Well, as I said, it's impossible for people on insulin, whereas it's frequent enough for people who take antidepressants. So that begs a number of questions in depression. Where did the chemical abnormality go? How can anybody be sure it was ever there? If the medication was correcting a biochemical abnormality all along, has the chemical abnormality spontaneously disappeared? Doctors have no idea because we can't check. So, in summary, the issue of serotonin in depression is utterly unproven, and it's one of the greatest examples of misinformation in medicine over the past 100 years. And the question arises, why would this be? And I'll go into that in another video, but perhaps it has something to do with the enormous financial gain that's involved in the whole treatment business of mental health. So I'll leave it at that. Thanks very much.